Is it normal not to orgasm? What are your thoughts? Is it healthy for women not to experience pleasure or relaxation during sexual intimacy? Let's answer this question now. I receive many questions about orgasm. We frequently encounter questions like, I don't feel any pleasure. I don't even want my husband to touch me. I don't get any satisfaction. Since I got married, I haven't experienced any pleasure. I haven't orgasmed. No fluid has come out. Do I actually experience pleasure or not? In our country, among the most significant causes of divorce are women's inability to experience pleasure, which leads to a loss of sexual desire, decreased frequency of intercourse, and emotional distance from their husbands. So, is it normal not to orgasm? When answering this question, we often see that many women are given misinformation such as, women don't really feel pleasure in the first year of marriage, or women don't orgasm before giving birth. Women who start their sexual lives with such beliefs report that even after 1, 2, or even 5 years, and having 2 children, they still don't feel pleasure. This is actually a very serious problem. Can it be normal for a woman to be married and not experience pleasure or orgasm during sexual intercourse? The mere asking of this question is upsetting for us as physicians. However, the question could be phrased differently. Can women sometimes not orgasm? For instance, if a couple has sex 10 to 12 times a month and a woman doesn't experience pleasure in a few of those instances due to her husband ejaculating prematurely, or an inability to concentrate, or engaging in intercourse out of a desire not to refuse her husband despite not feeling particularly desirous, this can be understood. In some situations, women may withdraw from sex and not be able to focus on lovemaking in that particular encounter due to fatigue, nursing their baby at night, inability to focus, having worries on their mind, or arguments with their husband. Consequently, they may not experience pleasure. But these situations apply only occasionally. If a woman doesn't experience pleasure in every sexual encounter, feels nothing, lies there like a robot, experiences no physical changes, no lubrication, no clitoral or vaginal pleasure, feels pain, or experiences tension, then something is wrong. In such cases, it is essential to consult specialists working in the field of sexual health. Orgasm is a learned act. Newly married couples may need time to get to know and learn about each other. Men learn ejaculation control and communication with their wives. They get to know their wives' bodies, touch, and discover what they like. As their experience grows, it becomes easier for them to satisfy each other. As a physician, when these questions arise, I often say, invest in your body, dedicate time to your sexual life. Dear ladies and gentlemen, orgasm is a learnable and improvable condition. You can learn through trial and error in many different positions. However, the easiest way to facilitate this is through education. For this, you can benefit from resources such as encyclopedias focused on female orgasm. These encyclopedias explain topics like vaginal orgasm, clitoral orgasm, blended orgasm, multiple orgasm, female ejaculation, and the phases of the sexual response cycle in detail, often with illustrated diagrams. What if an encyclopedia isn't enough? You're married, you're trying, you're learning, but there are still gaps. In that case, you might consider attending educational courses, whether it's marriage counseling for orgasm-related issues or learning about sexual therapy as a couple. You may consult gynecologists who specialize in sexual therapies. This way, you'll have a physical examination and your hormone and vitamin levels will be checked. Perhaps treatments like the orgasm shot, PRP, menopause management, or bioidentical hormone therapy might be necessary. If there's a vaginal infection, it needs to be treated. If there are problems like muscle spasms, tightness, or difficulty focusing, vaginismus, their causes will be investigated. Is there a lack of feminine energy? Are there negative perceptions about the body? Are there hostile feelings towards the penis or men? Are there errors in the meanings attributed to sexuality? Many incorrect perceptions about sexuality, such as sexuality is a carnal act, it's a man's business, men get pleasure, women conceive, women become mothers, women don't get pleasure, or it's shameful and ugly, can lead to a prolonged inability to orgasm in married women. That's why I repeat, every woman should experience pleasure during sexual intercourse. This is a need. During orgasm, many hormones are released, including dopamine, serotonin, endorphins, endogenous opioids, oxytocin, prolactin, and even testosterone. The woman bonds with her husband, and her husband bonds with the woman. Blood circulation speeds up with muscle contractions and relaxations in the body, ensuring energy regulation. The body completely renews its energy, rejuvenates, and finds healing. We recommend a regular sexual life. Depending on the age group, we suggest that a regular sexual life of 2 to 3 times a week is healthy, and for those over 50 to 60 years old, at least once a week. Sexuality is a shared experience where both men and women engage in lovemaking, feel excitement, passion, and find happiness together. If there are issues in this shared experience, the couple can attend educational sessions together, read encyclopedias, receive therapy, or consult a physician for treatment. The physician will investigate whether the problem is organic, psychological, or related to childhood traumas. They will evaluate many influencing factors, such as holistic emotions, e.g., hostile feelings towards her husband's family, or workplace bullying. Blood tests, hormone levels, and vitamin levels are examined to determine the root causes. Both psychological and organic reasons are addressed together to create a treatment plan, enabling that couple to learn to orgasm. Can orgasm be learned through education? Yes, it can be learned through education, in training sessions that you can attend individually or in groups of 5 or 10 women. A physician will teach you many things face-to-face or online using models, such as what the clitoris is, what the G-spot is, what shallow penetration is, what deep penetration is, and what positions like cowgirl, missionary, and doggy style are. They will explain using books and diagrams and provide support. With the help of an encyclopedia, through education, and with dedicated effort as a couple, God willing, you can learn to experience orgasm, discover new sensations, and even achieve squirting, also known as female ejaculation. Female ejaculation, or female squirting, means a woman's discharge of fluid. While men are known to ejaculate semen, it is unfortunately difficult for many to accept that women can also have an ejaculation, fluid release, or squirt. Many couples don't know how to achieve it, or if they experience it, they mistake it for urine and think it's a bad thing. Many women are confused by questions like, am I sick? Swing? Was that urine? I'm so ashamed of my husband. I got wet everywhere. I peed myself. Do I have a bladder prolapse? Operate on me, or let me stop this fluid discharge with radiofrequency or laser. I even urinate before sex. But where does this fluid come from? However, this is a phenomenon that occurs as an action when women experience a deep, advanced orgasm. But not every woman experiences it. It doesn't happen in every sexual encounter, and it's not a prerequisite for orgasm. Women sometimes experience clitoral pleasure, sometimes vaginal pleasure, and sometimes a combination of both. Sometimes they experience very deep multiple orgasms, and sometimes they squirt. Women are created very fortunately. They can experience different feelings in every lovemaking session because every cell of their bodies is created to be sensitive and open to pleasure. If their husband is also conscious of this, knows how to make love, values the woman, and has learned how to stimulate which areas, or how to achieve penis-vagina harmony in certain positions, then, of course, the woman will orgasm. What was our question? Is it normal for women not to orgasm? Or, is not being able to orgasm normal? No, quite the opposite. Not being able to orgasm is abnormal. A relationship where women don't feel pleasure feels like a chore or a burden. Then women gradually start to distance themselves from their husbands, saying, I have a headache, my tooth hurts, my muscle hurts, I'm tired, I'm sleepless. They become overly attached to their children, deriving dopamine from them, even showing them excessive attention, raising them like princes, kings, and queens, and receiving all love, dopamine, and happiness from their children. However, what we say is, women should orgasm. Women should share dopamine and oxytocin with their husbands. The woman should bond with her husband, and her husband should bond with the woman. So, dear ladies and gentlemen, women should experience pleasure in sexual intimacy. They should share pleasure to the fullest. Dopamine, serotonin, oxytocin, and many other neurotransmitters and hormones should be shared by husband and wife together to experience happiness. The question, is it normal for women not to be able to orgasm, is the wrong question. The correct questions are, how can women experience beautiful orgasms? How can they squirt? How can they experience multiple orgasms? Where is the answer to this? In learning, getting educated, reading encyclopedias, watching videos, and consulting specialist physicians in this field for examination and treatment. When a couple follows this path, the topic of orgasm will undoubtedly be learned and experienced in a very short time. We say, learn before you get married. Don't waste any time. Make a beautiful start from the very first night of your marriage and learn to experience and share wonderful orgasms in the very first weeks. For this, be sure to do premarital reading and take educational courses. Be sure to read about and get educated on orgasm. Improve yourselves with books and content that will enhance your dialogue as a couple, because the most important pillar of marriage is sexual intimacy. If the strongest shared experience in marriage is lived with satisfaction, almost every problem in these marriages is easily overcome, and marriages progress happily for a longer period. Children living in these homes also become much happier. I wish you all vibrant, fulfilling, and wonderful sexual lives and intimate experiences. Stay healthy and goodbye.